The broadcast is now starting. All attendees are in listen-only mode.
Welcome to the ASPP Presents webinar, IPE for Population Health, 3 Approaches and Assessments for MPH Level Interprofessional Learning. My name is Liz Weist, and I will kick off today before turning it over. This is the way for folks to submit questions and comments. In the right-hand corner of your screen, you'll see a chat box, and we welcome anything you have to say at any time during the webinar today. Go ahead and type it right into the box that you see there on your screen by the arrow. Here's our agenda for today. I'm going to go over the learning objectives, and I'll introduce all of our speakers. Our moderator then is going to frame the session. And then we have 3 exemplar demonstrations of IPE. After that, the moderator is going to hold a roughly 10-minute roundtable speaker chat, and then we'll have about 20 minutes at the end of the webinar to discuss the issues that came up today with all of you. Here are the learning objectives for today. We are anticipating that at the end of the webinar, you'll be able to describe one traditional approach and assessment that enables students to perform effectively on interprofessional teams. And that traditional approach is represented by Louisiana State University. The next objective is to describe one online approach and assessment that enables students to perform effectively on interprofessional teams. And that approach is represented by the University of Florida. And then lastly, to identify a process for managing large numbers of MPH students through interprofessional team experiences. And that approach is represented by George Washington University. All right, today we have some happy faces with us. Our moderator is Michael Fagan, and Dr. Fagan is the Chief of Public Health in the Department of Preventive Medicine, and he's also Associate Professor, Preventive Medicine, Public Health Practice at the Northwestern University Feinberg School of Medicine program in Public Health. And Michael is also a graduate of the Interprofessional Education Collaboratives Interprofessional Dean's Leadership Program of 2017. Our first speaker is Dr. Carrie Risolera, Associate Dean for Academic Affairs, Associate Professor of Environmental and Occupational Health Sciences, and the School of Public Health Faculty Liaison to the Center for Interprofessional Education and Collaborative Practice at the Louisiana State University Health Sciences Center, School of Public Health. Our next speaker up is Dr. Amy Blue, and Amy is Associate Dean for Educational Affairs. It's not advancing. Oh, I'm sorry. Dr. Blue is, I'll repeat that because I was seeing something different. She is the Associate Dean for Educational Affairs, Clinical Professor and Associate Vice President for Interprofessional Education at the University of Florida College of Public Health and Health Professions. And then our last speaker is Dr. Monique Turner, who is the Associate Professor and Associate Dean for MPH Programs at the George Washington University Milken Institute School of Public Health. Thanks to all of you. We're really looking forward to hearing what you have to say today. Mike.
Thank you, Liz, for that kind introductions, and I want to thank all of our speakers for what I know will be a really informative set of talks. Also want to thank everybody who's joined us. I'm sure you're here because, like most of us, you're struggling with this new CEEF criterion related to interprofessional education. So it's going to be a real delight to hear from 3 schools and 3 speakers that are taking different yet exemplary approaches to this. Interprofessional education has been around for a while, as most folks know, but it really is increasingly prominent in public health education and in schools and programs. And now we're required to do something related to it. As you saw on one of the earlier slides, we're supposed to help our students perform effectively in interprofessional teams. That could mean so many things, and depending on our environment, could take so many forms. So what we'll hear today is 3 exemplars of how that's being done at various schools of public health. I think the idea is to hear from our speakers and for those exemplars to really produce some questions, some thoughts for all of us. I know they will for me. And as Liz mentioned earlier, we'll spend 10 minutes or so after each of the speakers to really get a little more from each of them related to what they said. And then there'll be plenty of time towards the end of the webinar for all of your questions specific to any of the programs or more generally related to interprofessional education or this new SEEP criterion. So hopefully that sets the stage for what I think will be a really exciting and informative hour. I'm going to turn it over to Carrie, our first speaker.
All right, thanks so much, Mike. I appreciate it. So let's see. So just to give a little bit of background about some of the progression of things here at LSU at the Health Sciences Center. The way that things started really was a grassroots effort that kind of went on between 2011 and 2015. And what that consisted of primarily was an elective course that we had buy-in from the majority of our schools here on campus. And we also actually incorporated a couple of other programs outside of our university, including Xavier's College of Pharmacy. But the ultimate, I guess, turning point for us was actually the establishment of a center. So it's our Center for Interprofessional Education and Collaborative Practice. And that was launched in April 2015. The big support for the creation of this center and kind of to really have the administrative support that we would need to launch the center and get the buy-in on campus was through the quality enhancement plan. So that was one of the requirements for the reaffirmation of our accreditation through SACS and their commission on colleges. So the goal of this center overall, we wanted to prepare our students across the Health Sciences Center, across all of the professions that we have, to be able to practice in teams. Because we had seen from a lot of the evidence that's out there that team-based care can result in overall improvement in health, and in particular community health outcomes. So in addition to this center, I also wanted to mention we have IPSA, which is our Interprofessional Student Alliance. That was kind of started in the middle of those grassroots efforts in around 2014. And they really have been a truly student-led interprofessional student organization. And their executive board, for example, has a rule that it can't duplicate programs throughout its executive board membership. And they have a lot of different projects that go on throughout the city of New Orleans with a main focus on community outreach and in particular addressing a lot of the significant health disparities that we see within the city through work with the New Orleans Women's Shelter, the Adolescent and Reproductive Health, also do a lot with the Cooking Matters program, and have even created a student garden here on campus as well. So that support from the student side really has really helped us in any successes that we've had so far with IPE. So our first initiative throughout the center was an IPE day. The inaugural one was in 2016, and then in 2017, we actually enlarged everything and kind of went beyond with regard to student participation. So we had approximately 750 students that represented 25 different professional programs here on campus. And what I was really happy about was the focus of the initial one, which was immunizations and improving those rates. And something that I am really happy about and happy to report is the link with public health. You know, I think a lot of times one of the big barriers that at least I know I've faced is that they're not really sure what to do with us with public health, especially those in the really clinical side of things. And looking at things like immunizations and looking at these areas of overlap, I think have really been helpful. And so what we did was created a case around immunizations, and we formed the IPE teams from these representative programs. And their goal was to develop office policies and procedures that are related to clinical operations surrounding immunizations. So talking about things like who actually can have an impact on immunization rates, and really kind of hammering home that idea that just because you're not the one delivering the shot does not mean that you cannot have an impact on vaccination rates and on the actual health outcomes. And one of the good things about this particular IPE day was that it has led to a practice-based discussion and even an implementation in the expansion of kind of these roles related to immunization. Through our dental school clinic, they actually have taken this to the point of requesting and obtaining access to the state immunization database, so that as patients come through their dental clinic, they're able to monitor, look at, and advocate for immunizations for their patients as they come through. And they've been working with our groups here in the School of Public Health with kind of the immunization education and policy development related to that. So the ultimate goal, though, was to kind of take this beyond the voluntary and to really have something that is truly integrated into the curriculums of the programs that we have here on campus. So where that led us was to the creation of what we call TeamUp. It's a 2-year longitudinal experience with the focus on preparing our students to become collaborative practice ready. It's a required component of existing courses, so this is not new curriculum that was instituted. It was integrated into already current curriculum. It encompasses all 6 schools as of this year. The first year, our pilot year, we did not have participation from graduate studies, but now we do. So we have that. Their PhD programs are integrated as well. This list that you see here on the right just kind of gives you an idea of all the different programs that are represented, and really the clinical professions that kind of comprise the bulk of the programs here within the Health Sciences Center, I think have really helped our students in some ways within public health and helping them learn how to advocate for their role in healthcare. And just sort of conveying that idea that if you're seeing patients or clients and you're sending them right back out to the environment or community that made them sick in the first place, you're really going to just end up going in circles. And so really looking at what public health has to offer and being able for those public health students that we have to advocate for the importance of their role in health and healthcare. So a little bit more about TeamUp. Our inaugural cohort participated in September of 2017. There were 659 first-year students from 19 of those programs in the 5 schools. We convened 65 teams on a monthly basis across both downtown, which is our primary campus, and the dental school campus, which is about 20 minutes away from our downtown campus. But the focus on that year 1 is really to build the interprofessional team. So how do they develop effective communication and collaboration skills? So we have topics like art of observation, immunizations and motivational interviewing, communication and mindfulness. And the culminating project associated with year 1 is what we call a health partner project, which I'm sure that will sound really familiar to Dr. Blue. So she has been a huge help to us as we were developing things. And what they do there is just to apply these teamwork skills. And so what they're doing is engaging with this individual about their past healthcare experiences, communicating with each other as a team, and kind of combining and coming together to develop lists of community-based resources that could be of potential help to that health partner. And then in year 2, things move on and they actually move into more case studies, and it covers a pretty broad spectrum of different patient or client conditions. But the overall theme that goes throughout all of these cases are primary and secondary prevention. So really public health is kind of an integral part through all of these case studies with topics like pediatric obesity, polypharmacy and geriatrics, alcohol use disorder. So there's a lot of different, I guess, cases that are there that the students can really shine from a clinical aspect. But also I think it gives public health a real opportunity as well to be able to weigh in. And from an assessment standpoint, we're doing a combination of these culminating type projects, but also a lot of individual-based and also team-based reflections. that help kind of give us a better idea of how the teams are forming and how those interactions happen. And just some of the, real quick, some of the main challenges, I guess, that I'll mention, as you can imagine, from having these 65 teams in year one all the way to double that, in essence, in year two, because having both cohorts going at one time, space is huge. Where are we going to put all of these teams? Also, the faculty commitments, so faculty facilitators, and having enough facilitators to cover these teams, to make sure that progression is there and that the teams are interacting and they're working through the activities in a way that actually can result in, you know, better team-based outcomes. So all of these things are sort of hiccups along the way, but that's also things that are shaping our discussions as we move forward. How are we going to do a better job at making sure there's, number one, consistency across all of these teams, that they are receiving the same content. So we're looking at some other options that can help also reduce the amount of faculty commitment time. So not only the face-to-face facilitation type time, but the training that goes along with that. And so moving towards things like maybe using our team-based learning center that is recently completed within the med school, that we could do multiple teams in one room with a limited number of facilitators. Those are all things that we are sort of looking at, and you can see in the purple box there, kind of from a time commitment, how much is actually involved from the faculty level, and so still trying to address those. But with that, I will, I guess, turn it back over to you, Mike.
Amy, you could pick up if you're ready.
Sure, thank you, and thank you, Carrie, for the kind words. It is exciting to see what you folks have done there in a really short period of time. So what I'm going to share is our experience at the University of Florida, and just to give you a little bit of the learning context, while we do have an on-campus MPH program, we also have an online MPH program. And here in the Health Science Center, we also have a Doctor of Nursing practice in our College of Nursing. And being online, both of them needed to be thinking about an IPE experience for accreditation purposes for their learners. So both groups were willing to partner and think about how they could do this. And here at Florida, we've had for several years an existing activity that we call Interprofessional Learning Healthcare. This is actually the activity our on-campus MPH students participate in. And we thought, well, could we convert this to an online experience? And that would mean the translation of 3 in-class activities, those in-class activities lasting about 2.5 hours or so. And to provide you a little bit more information about IPLH, it of course addresses several learning objectives, including interprofessional teamwork, the HIV/AIDS care continuum, and this particular content focus we've had for a few years due to funding from HRSA and through the AIDS Education Training Centers and our work with the UF SAETC. Other learning objectives include patient safety concepts, trauma responsive care, and community education interventions. Now on campus, we use a very loose adaptation of a team-based learning format, for those of you who are familiar with that. And this includes the students completing the individual readiness assessment test and then the team readiness assessment. And then on campus, the students complete specific products for each session in teams. So we were really beneficial, really had a lot of benefit by working with some fabulous instructional designers to take what we were doing on kind of paper in class to the online environment. And this is just part of the screenshot for the opening page for IPLH. And we had recognized we were going to have the students work on their activities in modules asynchronously to have time to work on the products. And we added an introductory module to start the sessions off. Now, students through each of the modules learn about Morgan Rivera. And Morgan is a fictional story. She's a woman who has been diagnosed with HIV/AIDS. And actually, that happened when she had gone to the hospital. She had fallen and broken her arm because she'd been partying too much. Morgan actually has some substance abuse issues. She has some depression issues. She unfortunately experienced several adverse childhood events. So there's a lot going on in her life currently as well as in the past. And our instructional designers came up with basically an electronic medical record for the students to go to access information about Morgan. And with that first hospital stay, actually there were two, things did not go particularly well in her care. So what the students and their teams need to do is complete a root cause analysis report, and that would include a fishbone diagram. So these are just some snapshots of what the students have to complete. When the students progress to Module 2, their goal is now going to be to retain Morgan in care. And again, they go to this electronic medical record, but each of the students in the team get some specific information that they have learned through their encounters with Morgan. And then as a team, they are to share that information with each other and then develop a retention and care plan. What the students don't know until they meet as a team is that some of them have received conflicting information from Morgan about what's going on in her life. And so the challenge is to work through that as a team. Specifically, what they need to complete, as I've already said, is the retention readiness form. And then we want them to practice doing an SBAR, a communication tool of situation, background assessment, and recommendation. So we ask them to write that out based on one of the issues going on with Morgan, and then also describe her ecological environment. When we move to the final and third module, we want the students to be thinking less about their care with Morgan as an individual, but to look at several, or specifically one of the issues going on with her, and think about that at the community level. So when they get back into the online environment, as you can read here, they find, quote, a note stuck to their chair, and that will be presenting to the community stakeholders next week, and they need to begin to think about what that issue would be and how they would design it. So they do need to outline a community intervention addressing one of her issues. These are two examples from groups that addressed her issue related to intimate partner violence. So that's essentially the content in broad brushstrokes, as well as the team products that the students work through. With respect to learner assessment, we use a variety of tools. One is, because there is reading associated with each of the modules, the students do complete that individual quiz just as they would on campus. We couldn't figure out how to do it in a team environment, so we focused on the individual quiz. What we want them to do as individuals is reflect on their teamwork, not only their own skills, but that related to their teams, and there's feedback on the reflections. And we also use the comprehensive assessment of team member effectiveness, also known as CATME. It's a peer evaluation tool. And using that tool to get that peer evaluation also helps them reflect on their teamwork at that mid and at the end of the experience. And then as faculty, we went through each of the team products, provided feedback on how those appeared. And then we also had students complete locally developed self-assessment instruments, which really are more for program evaluation, for us to see, were they learning the content we wanted them to learn? Did they feel like they were gaining skills? Was working in this particular online environment conducive to their learning? So real briefly, some lessons that we learned from this experience was we were able to successfully transfer the campus experience to the online environment. And in fact, the students were very positive. They indicated through their evaluations that they felt like they gained content, that they gained skills that they could transfer over. And this was nice to see. And we found that 4 students per team was really the ideal number. So we're going to keep that moving forward. We'd had a few teams of 3 didn't quite work out as well. What we want to do moving forward is hopefully have some more professions involved, just to make this a little more interprofessional in terms of breadth. So we're talking to some of our on-campus programs to see if they'd be willing to switch timing for their students and format. And for those of you who work in the online environment, this probably does not surprise you that oftentimes that actually does require more faculty time, which was true for this experience than it does for the campus version. So we recognize we're going to need more faculty facilitators. We had 2 facilitators this past summer working with about 20 groups each. We had about 80 students overall in this experience. And as with pretty much everything interprofessional, it is a group, an interprofessional group that helped us put this together. So I'm just listing our collaborators here, and my thank you to them. And finally, also thank you to our members with the UF Southeast AIDS Education and Training Center. So I think we'll pass the baton on to Monique.
Great, thank you. So you've heard a couple excellent examples of how to create cases and engage in assessments, and GW followed a similar process with regard to those processes. But what I've been asked to do today is really talk about how you organize the logistics with a large MPH program. And so let me give you a little bit of background. So about a year ago, when we were at the ASPPH conference here in Washington, D.C., I went to the IPE panel. I'm sure many, if not all of us, did. And it was fantastic, right? I learned about some really interesting, innovative ways to get MPH students an interprofessional experience. And I spoke to one of the panelists afterward, and I said, this is amazing. How many students do you have in your MPH program? And I remember that she said around 50, sometimes fewer. And I said, I'm wondering how I can scale this up for between 700 to 1,000 a year. And she laughed and I laughed. And so that is what we've been contending with. We now obviously have a process in place, but I'm going to take you back in time and talk you through some of the issues we had to think through, and then I'll tell you how we're accomplishing this today. So the first thing you have to consider is that we have to have multiple partners. Now that's true of everybody. The examples you just heard brought on as many as 25 other programs. We need to have at least opportunities for approximately 750 to 1,000 students a year. Those students are both from our online program as well as our residential program, and I'll break those down separately in a second. That's a minimum of 750 other students. So in so doing, we have to think outside of the box. In our online program, we approached it with what we think is a very traditional way of bringing on programs from medical schools, social work, physical therapy, physician's assistants, nursing, and so on. But in order to make this work, we also have to think about law schools and having a health policy case, or going to a public policy school and still doing a policy case. Going to business schools and working with marketing programs and having a social marketing case. Likewise, we could do that with our communication program here on campus. That means that we have to create multiple cases so that when our partners change, the cases change so that they are interesting and beneficial to the partners we've involved at that time. Now, the other issue that I think was mentioned earlier as well, is that our partners are not required to do an IPE. They don't have to offer this for their students. So we have to provide a compelling case for them. Now with our first set of partners, the MDs, the MSWs, nursing schools, they were inherently interested in doing this, and developing those partnerships was fairly easy, frankly. But developing partnerships with some of our other schools in public policy and marketing and law, it takes a little bit more of creating an interesting, compelling environment and making sure that they feel that their students can really gain from engaging in this. And so we've had to have an IPE committee here on campus with connections and partnerships with schools throughout the university that can provide those persuasive arguments. Okay. Now, we also need to find alternative opportunities besides these traditional cases that I'll walk you through in just a second. So, for example, here in our School of Public Health, we have a number of classes that bring in partners to the classroom, and the students work with that community partner or client, if you will, and they work on a project with them the entire semester. So now what we're going to do is introduce formal and consistent assessments into those classrooms so that the students in those classes can achieve their IPE credit, which I'm using loosely because our students won't actually earn credits for this, but they can get this requirement in their classes as long as those classes meet our CEEF requirements. In addition, we have a program here called Eyescopes. And what Eyescopes is a team-based initiative that places students with community partners, and they work on an interprofessional activity to address public health challenges, and it's a year-long requirement. So this is actually a very intensive interprofessional experience. Right now it serves about 60 students a year. Going forward, we'll open up more opportunities for students to do that, and they can earn their IPE experience in that fashion. So let me tell you what we're doing. Whoops, can I go backward? Thank you. So let me tell you how this comes out in reality. So for our online program, we have created partnerships with other schools that also use our third-party vendor who runs our online program. So our partners include Georgetown, USC, Yale, American University, and several more. And we've particularly created a coalition of the PA programs, PT programs, MSW, nursing, MPHers, and a few others. And 3 times a year, we will offer an opportunity where students will be given access to our learning management system, and they're going to see both a video as well as a print version of their case. Currently, the case is about Mrs. Larson, who lives in rural Kentucky. She's having some symptoms indicative of a heart attack, but she's not aware of that. She delays going to the hospital. She's a senior citizen, by the way. The next day, she goes into the emergency room, and the students take the case from there. After they watch the video, read the print materials, they also receive information on rural Kentucky. They receive information on heart disease, and then they come together for this virtual IPE. We have about 200 students come together from these various programs, and this is going to get larger going forward. And they are given an introduction by one of the professors, one of the faculty, and then they break up into distinct online classrooms of about 10 students each. They are given discussion questions to work through. They are also all assigned a facilitator who's in the room with them that is engaging in their own assessment. And then after the case, all 200 people come back together and report out. That takes about 3 hours altogether. After the report out, when the students are back by themselves, they do a post-test quiz and a reflection sheet that we collect as our assessments. So that's how we're going to be doing our online IPE. We're going to have to find more partners and more cases as we move forward each year so that we can meet the demand for even more students. Residentially, right now what we're doing is connecting our students not only with Eyescopes and the classroom experience that I already described, but also with our medical school summits. Medical school summits happen approximately 4 times a year, where the med students are given a complex population health case, and they work on it for a number of weeks. But during the summits, we bring in for about 3 hours public health students, and they're assigned to the various teams to serve as prevention or population health consultants. And they'll work through that case with them, provide advice, tell them how they would think about this. Again, they're given directed questions to work through. They have a liaison that will observe them. And then at the end, they give a short presentation. These students will also do the post-test quiz. They'll also do the reflection sheets that we will capture. So I think what you'll find is in practice, our IPE doesn't look too different from the other cases that you found. Logistically, what we've had to work through and get creative about is how to ensure that we have enough opportunities for upwards of 700 to 1,000 students a year. We think we found a way to do this, and I'm happy to answer more questions if you have them.
Great. Thanks so much, Monique, and all of the speakers for those wonderful examples. We limited each of the speakers' time to 8 minutes or so, so no way any one of them could go into the level of detail that I know is racing through my mind. So for the next 10 minutes or so, what I'll try to do is dig even a little deeper into each of these 3 examples and see what these 3 schools are doing related to their IPE activities. It strikes me, listening to the 3 of you, that these are very resource-intensive activities. I'm wondering if you can shed some light on the kinds of resources that are necessary, both financially and personally and temporally, and how you've gone about either cultivating those or gaining those. And that goes to any of the 3 of you, whoever's feeling bold and ready.
I'll take a stab. This is Monique. It certainly is resource intensive. First off, we need to have enough liaisons or facilitators for every single session. Sometimes it takes 30, 35 people that we have to bring in, and those are volunteers. We use our practicum directors, our advisors, faculty members that are willing to do that. And then, of course, sometimes our partners also have facilitators that will join us. So we're not using financial incentives there, but it certainly is human resource intensive. Also, in terms of creating the cases, what we've had to do is take people in their existing jobs and make that part of their job description, right? So, for example, as Associate Dean of MPH programs, I obviously have a lot of skin in this game, so I'm working closely with our Eyescopes director, who is trained in IPE, to make sure that we have the right cases. So because we're not putting in additional financial resources at this time, we're really trying to figure out, where and with whom can we place different distinct pieces so that we can get this done, in a way that is affordable.
Thanks, Monique. Carrie or Amy, do you have anything to say about resources?
Yeah, this is Carrie. Oh, sorry, Amy, did you want to go ahead? So one of the big things, and I think you can kind of see when we talked about the number of students that we have engaged in our current 2-year plan, if we hit ideal, we were looking at needing over 600 facilitators total if we had a one-on-one relationship with each of the teams for each of the sessions that we have throughout the 2-year progression of things. That's not very realistic. I think that we did really well engaging the faculty here, because as it stands now, that's one of the big hurdles that we need to overcome, is the idea of utilizing volunteer time, in essence, from faculty. So it's not so much that things were removed from plates, this was added to current responsibilities. And so by moving towards utilizing larger spaces with fewer facilitators, we're hoping to address some of that. But it is a huge ask. And one of the I guess, methods that we used to try to overcome that was, so Tina Gonaldo, as our center director, along with the 6 of us faculty liaisons, went through to all of the promotion and tenure committees across campus, talking to them about the value of participating as a facilitator with IPE and how that can help faculty progress towards promotion and tenure, and really getting the buy-in, not only at the dean level, but also at that promotion and tenure committee level, I think has really helped with regard to kind of defining the value there, and also really just putting things into numbers like I showed you there as to how much time and effort it does take from the faculty side of things, from the training to the actual classroom or facilitating hours, and to grading and reading a lot of these reflection assignments. I think quantifying that and putting real numbers next to it have really helped from that sort of resource standpoint.
So coming from the University of Florida, where we've had for a number of years a centralized office to support IPE, we too have same challenges that both Monique and Carrie have listed out. We actually have a very faculty-intensive first-year activity for first-year students. So when we designed the interprofessional learning healthcare for second-year students on our campus, we went to that modified team-based learning format to try to reduce the need to have a lot of faculty involved as facilitators. It does become a numbers game, and I've appreciated learning from both of the other programs described as to how they deal with this.
Yeah, it really strikes me at the scale that the 3 of you are doing this as an extremely resource-intensive activity or set of activities. So I do have other questions related to that, but moving on to another kind of question in the interest of time. What kind of structure are each of you giving to your IP activities from a curricular, a grading, a credit perspective? I know there wasn't much opportunity to talk about that during your individual presentations, but I think many of us are curious about whether this lives as something that's co-curricular, extracurricular, baked into the existing curriculum. What are your structures and how did you arrive at them?
I'll jump on that. So it's a mix of both at GW. We created a new leadership course that's going to tackle a number of the leadership and management competencies that CEEF is requiring, and every student will take that class in their very first semester. That class is also going to provide the didactic experience surrounding interprofessional experience. So they will learn what interprofessional experience is. They'll take some personality assessments. They'll take quizzes, etc. And at that time, they'll also be told that they will need an interprofessional experience before they can get cleared for graduation. So they will be then kind of pointed in the direction of how will these opportunities be announced, where will you see them, how do you register for them, and so on. So then once the student is out of that class, they'll be on alert that they need to be looking for opportunities. When they see one that they want to take part in, they will register, but it will be for a 0 credit class, if you will, a 0 credit opportunity. That just provides us with a roster so that we can then move forward in an official way. And then they'll engage in the various experiences that I outlined before. So it's both in the classroom, but the actual experience is out of a classroom.
Great, thanks.
Yeah, I was going to say at UF, and while we have an office and we've been doing multiple IP things for many years, I joke that I think it would take an act of Congress for our office to become an official academic unit and be able to give courses that are transcripted. What our agreement is with each of the colleges and programs that participate is that this is a required activity embedded in one of their existing courses within their college. With our online example, it was part of the MPH seminar, which again gets course credit, and then for the Doctor of Nursing practice, it was one of their required courses. And there's the agreement with the program that if there are issues with the student's performance, that will alert the program, or the program will alert us, and then the appropriate academic repercussions or issues need to be resolved. So while these are required activities, they're built into the curriculum. Here at UF, they're not separate transcripted courses.
It's Liz. Carrie, your turn, and then we will need to move on to the Q&A period, Mike, if that's all right.
Works.
Sure, I'll be quick. Yes, ours is part of the required curriculum, so it's embedded in courses that are currently required by all of these programs. We do have, so first year of the TeamUp Experience is embedded into first year courses throughout all of the programs. And what we're doing is, so they have 14 contact hours total, so there's 7 2-hour sessions across an academic year. And we got the course director buy-in, and all of the programs, actually, this is probably somewhat miraculous, but agreed that if a student does not pass TeamUp, they don't pass the course. So they would not pass a required course and would be required then to retake that, putting them back in some cases a full academic year. And now the requirements are the assessment levels. Primarily it's done through attendance and through submission of these reflection assignments. And so trying to keep that as condensed as possible with regard to the expectations and time, that it's more about them showing up and engaging with their team for those 2 hours is really the most important part of that. But really having that embedded within the current curriculum has been the approach that we've taken so far.
Wonderful. I know our time is up. Thanks to all three of you for that. And I'll toss it back to Liz for general Q&A from our webinar participants.
Super, Mike. Thanks to you and all the speakers. We do have a number of questions here in the box, and in case you have not submitted, go ahead and type it in right there where you see your arrow on the screen. So if you have something to say, go for it. And here's what we have so far. The first question, Dr. Brissolera, goes to you, and it's who teaches the competencies of IPE, and which rubric or rubrics are you using?
Sure. So it's through the facilitators themselves. We have set those IPE, the IPEC sub-competencies, sort of the basic ones, you know, the values and ethics, roles and responsibilities, the communication, and then teams and teamwork. And so that's part of the faculty training for those facilitators, is which of those particular competencies are associated with each individual session. And then the sessions are all built from a content standpoint. We deliver that through our online delivery system. They are in person working through it, but they can all see the same content that way online. So like, for example, with Art of Observation, they work through that together and have various videos and things that they take a look at. And so it really is kind of coming back to those facilitators who have been trained to do those assessments. Now, like I had mentioned before, we have those reflection assignments from an individual and then also a team basis. So those are reviewed for that competency attainment. And then we do have the SPICE, I believe, I'm trying to remember what SPICE stands for, but that assessment on readiness for interprofessional experiences. And so we give them that at the beginning of year one and then also at the end of year one, and is part of their reflection assignment as well. So it's more about that, I guess, the readiness to experience this and to be open to it, in addition to more of the qualitative kind of reflection assignments.
Great, thank you, Carrie. The next question, Amy, it's for you. It's how many hours of work did this take students to complete on the average?
That is a great question. It was one that we were mindful of, and I'm now trying to guesstimate back. We were thinking about 10 to 15 hours or so in total, yeah. Okay. And over several week period of time.
Great, Amy, thank you. And back to that SPICE instrument, we looked it up here. It's the Student Perceptions of Interprofessional Clinical Education, and the first one that popped up is revised. So SPICE-R.
Yes,
Okay.
the R2 actually is the one that we use.
Oh, great. It gets a thumbs up from Carrie. All right, back to you, Amy. Another question here. In the UF example, was there an observation of IPE behaviors? The person didn't hear that. And then doesn't CEF require this? And that's what this questioner had heard from CEF, that it's required.
Right, and so this is where I'd love to learn from others, because this was something we really, chatted about and sort of are taking proxy measures by looking at the students' reflections of their teamwork, kind of asking them their processes around teamwork. I will tell you that students did acknowledge when team members were not stepping up to the plate or when they themselves were not stepping up to the plate. So I found that actually very refreshing. And then we were looking at the products of another way to see how did that teamwork come together.
Excellent. All right, this next question is back to you, Carrie, and it's, you assume the faculty has the knowledge and skills of an IPE facilitator. How do you handle that? What kind of preparation do you undertake?
Correct. So each facilitator has to attend the training session that coordinates with the IPE session they're going to facilitate. So for example, for year one, we have 7 different IPE sessions around topics that I think I'd mentioned before, like mindfulness, art of observation. So they attend that coordinating training, which is a 2-hour training session that not only focuses on the topic itself and on the content that the students will be working through, but also facilitator type tips. And in addition to that, they have to participate in an overall, I believe it's a half-day workshop on kind of the overview of facilitation and really emphasizing that need to step back. That facilitation is more about making sure the students are progressing through than lecturing. So that's really been something that we've tried to promote. And all of those as well, one thing that we do offer kind of as an incentive, in addition to kind of the promotion and tenure side of things, is that we were able to grant CME and CNE credits for those, so they can get continuing education credits for that training and actually include that as part of their development, faculty development.
Wow, that's very creative. Thank you. This next question goes to all of you, and we could start with you, Monique, if you'd like to address it first. Here it is. It's some thoughts and then the question. It seems as if the majority of case studies that are used in the IPE exercises you presented today are clinically based, focus on one person patient with a small component of exercise focused on public health. What feedback have you received in your evaluations to demonstrate that such clinically focused students have a better understanding of public health and the impact that social determinants may have on the health of that individual patient studied?
Yeah, that's an excellent question. So for our first round of this, you are correct. We created a very clinically based case. However, in the questions, the speaking guide that all the groups receive and their facilitator also receives, there are questions relevant for each of the professions there. So, for example, the public health questions revolve around heart disease for this community in general, prevention for the future. If we were going to try to go back in time and prevent some of these issues for Mrs. Larson, what are the steps you would take? What would you recommend? What kinds of interventions would be appropriate? Those sorts of things. And then there are questions relevant for the other professions that are available as well. And then at the end of the experience, when they fill out their self-reflection, one of the questions is, what did you learn about these other professions? And they have to go through the other professions that were available at that case. Now, we don't want to only have clinically based cases. So as we evolve and move forward, as I mentioned earlier, we will create health policy cases, social marketing cases, epidemiology cases, and so on. So we want to make sure that we can get a variety of partners involved, and that means a variety of cases. But we did start clinically.
Thank you, Monique. Amy, do you have a response?
Yes. So for our IPLH activity, our focus on HIV/AIDS, as I've already said, was actually due to the partnership here at UF with our AIDS Education Training Center. We hadn't had that focus for a couple of years. It had a variety of topics, but we bring in the public health through a variety of ways. Actually, one of the things that goes wrong in Morgan's care is she's not linked appropriately with the health department and really getting information about her condition and those kinds of linkages. And then, of course, all the way up to the last activity where we're asking the students to be thinking about health issues, but really at that community level. As Monique has said, we make sure the cases do encompass aspects of care related to other professions. So because we do this on campus with, dentistry, speech language audiology, OT/PT, there are some other things involved in her care. Our feedback from the students have been that they appreciate thinking beyond just the clinical. We really kind of downplay. We're not looking at diagnoses and treatment. Again, how do we retain somebody in care who has a variety of social issues that are going on? So we find the health profession students appreciate that, and of course, it also allows them, the NPH students, to share their knowledge and their perspectives with these other learners.
Fantastic, Amy. Carrie, do you have something else to add?
Yeah, I just would reiterate what Amy said, trying to steer that discussion away from the idea that we're trying to diagnose something, that it's more about perceptions. So asking discussion questions around the idea of why would it be beneficial to have other professional perspectives here. And then we also, as part of a facilitator guide that we developed for year 1 and year 2, we have sort of prompts for facilitators, I guess, that are related to each of the programs that are participating. So, for example, one of the struggles that we have is kind of the opposite of what Monique was talking about, is that we don't have enough public health students that represent across every single one of those groups. So to make sure that that perspective is brought up with these other groups that, say, are a little bit more clinical on the clinical side, to make sure that they understand the facilitator is able to provide the public health perspectives that go along with each of these scenarios or topics, and to make sure those points are brought up as well.
Thank you, Carrie. We have a number of other questions, so I'm just going to ask one of you to respond because we're almost out of time. And this is a really interesting one. Are there any cases where students would produce a product in IPE that would be usable for the applied practice experience component of the CEIF requirements?
Yeah, this is Carrie. Actually, ours in year 2 does. So the year 2 kind of culmination there is that they are really talking about the development of an interprofessional, either primary or secondary prevention assessment tool. They're assigned either an age or a medical condition and work together to develop a, kind of quick and dirty in some ways, primary or secondary prevention assessment tool that could be utilized either through their residency, if you're talking about on the clinical side, or with public health, something that they could then apply, hopefully, as part of their practice experience or within our culminating experience as well.
Way to leverage. And then a quick answer, I'll ask you, Amy, this one, please. What method and this is our last question, what method do online MPH programs use for teamwork, for example, web video conferencing?
We actually were not prescriptive about that in terms of whatever then was going to work for the students. We use Canvas as the course management system, but I think our students used a variety of features, Google Docs and or webcams and things like that. Yeah.
Great. All right. Thank you so much for those questions that didn't get answered. I'm going to channel them to the speakers and see if they might answer after. Here's a great quote from a student at GW, how much they love this kind of learning. I want to thank our presenters today, Mike Fagan from Northwestern, Carrie Bristolera from Louisiana State University, Amy Blue from Florida, and Monique Turner from GW. Super job. One of you mentioned coming to our annual meeting last year, and I want to make sure that you know about what's going on this year. It's March 20th through 22nd, we are going to have a special session on interprofessional education. So hope you can come and make that and learn from it. And also our undergraduate public health and global health ed summit precedes the annual meeting. So registration's open for both events on our website. Our next webinar coming up in the series is February 6th. It's on admissions, data trends and analytics. And the target audience is admissions staff, data users, administrators. For more info, you can go to our event page at the link there. So this webinar has been recorded. It's going to be available on the webinar site. And you can see the link there. And I neglected to give our moderator, Mike Fagan, the final word. So I'm going to flip back to you, Mike, for a closing summary before we end today.
Oh, that's kind of you, Liz. I appreciate it. I know we're at our end point, so I'll be super brief. Again, express my thanks to the speakers and their examples, and also to all the participants in the webinar. I know I heard a couple things that seem to really cut across folks' questions and the like. One is, how do we assess this? We know that CEEF requires us to do it, and we heard some great examples from our speakers, and I think there's a lot of opportunity to even dig deeper into that piece of it. How do we train folks who facilitate the activities? We can't assume that folks know how to do this, and we heard some nice ideas about how that can be done and incentivize. And really the last thing I wanted to say, maybe this is mostly for myself, is just a reminder that despite this being a new CEEF criterion, the reason we do this is because we know that our students will need these skills when they're out there in practice. So I know for me anyways, that's a great reminder as I sort of fight through some of the barriers to make this happen in my setting, that really this is about creating a better public health professional. So thanks again. Look forward to continuing this conversation with all of you in the coming months.
Thank you, Mike. Thank you, everyone. The webinar is adjourned.